welcome. You're joining us at Hyde Park on AdaDerana 24. And tonight on the show, we thought of talking about how Sri Lanka is facing the current outbreak of the global pandemic COVID-19 here in Sri Lanka as we face a third wave and continue a vaccination strategy as well as combating an operation to combat the virus. I've invited in studio Dr. Hemantha Herath, Deputy Director General for Education and Research of the Ministry of Health, joining us. Thank you very much for your time here.
Most welcome.
And I've also invited to our studios Professor Atula Sumatipala, Chairman, National Institute of Fundamental Studies. He's also a member of the National Operations Centre for the Prevention of COVID-19 Outbreak. A very warm welcome to you. Thank you. And I've invited to join us virtually from the United Kingdom, Senior Research Fellow for Global Health Clinical Informatics Research Unit from the University of Southampton. A very warm welcome to you, Dr. Michael Head.
Good day, and thank you for the invitation.
Thank you very much. So I thought I'd start off talking to Dr. Hemantha Herath. Talking about our vaccination drive here in Sri Lanka, where are we currently? What is the situation now? Because we hear a lot of concerns from the general public and a lot of messages from authorities also about the success of this program. But there is concern from the public about maybe the second dose or what kind of vaccination they're going to be inoculated with. What's the status as of now?
Yes. As far as Ministry of Health is concerned, I would very confidently we can say that whatever the so far what we have achieved is, I think, it meets our expectations. However, the most of the problems or issues that raised and what we experienced was in a way and to a great extent, it was totally beyond the root cause was totally beyond the control of the health ministry as well as even with the government. The main reason why the way that we did this immunization campaign, the way that we did in this manner was basically due to the restriction in supply of vaccines. Initially, we had the plan when the WHO informed us about their willingness to provide the vaccines. They promised us to provide 4.5 million vaccines to cover roughly 20% of the population, and they were expecting, I won't say that they promised, but they were expecting to supply these vaccines in 3 installments, 1.5 million each in each quarter. And also with that one, His Excellency the President and the Minister of Health, they appointed the Mr. Lalit Weeratunga also as the top level official to coordinate this process, and as a result we were planning to have this vaccination expecting reasonable quantities of vaccines arriving in the country within the month of February to cover significant proportion of the population within that month. However, we know that once we started this program, because of the developments in other parts of the world, including our neighborhood, the expected stocks did not arrive. So from there onward, we had to change our strategy to high-risk areas and carry out the same program in a phased manner, so that we need to get the maximum benefit out of the available vaccines. So that is what made us to develop or to engage in this process, and as a result, we know that there were not everywhere, but in certain places there were overcrowding and there were some kind of the fail to meet the expectation of the people, failure to meet the expectation. But I would say that we have already immunized more than roughly 1.5 million persons have been immunized, and about 5 million people have been immunized with second dose of vaccine as well. roughly.
Right. I'd like to talk more on that, but to move to Professor Sumatipala, I think you'd also, I seek an explanation on the current vaccination drive. Are we on course here?
Yeah, of course, yes. I actually want to add to what Dr. Hemantha Herath said, because we need to understand the context. Now, I always say, I have personally done research to show 90% of medical knowledge in the world come from 10% of the population. So we have analyzed 5 leading medical journals, Lancet, BMJ, JAMA and things like that over 5 years to show 90% of research come from the 10% of Western countries. But when it came to this complex emergency, what we call the COVID pandemic, even that knowledge was not there. So to start with, we are lucky within 1 year, there are so many vaccines produced by those countries, number one. Number two, as Dr. Herath very correctly said at the very beginning, COVAX facility promised to give certain number of vaccinations. Then we bought some and got some free donations as well. So things went wrong, not for us, not only for us. And again, remember, 52% of the vaccines were bought over by 13% of population countries well in advance, even before the production. So it was a complex issue. Now, the fact that we are again lucky that at least we are within the 50 countries. There are so many countries who have not even heard about the vaccine. So yes, there were challenges beyond our control. Number two, when it comes to vaccine, we should remember we are a country where we had a 40 years history or more than that, very smooth vaccination program for triple and things like that. But remember, that was under peaceful situations. But even during the 30 years of war, even and North and East, people were 100% vaccinated. Now, when it comes to this issue, it's not, it couldn't be delivered on a red carpet. There were challenges. The vaccine has to be delivered, deployed within a short period of time, and people were panicking, you know, because it's. So I think we need to understand. My personal message is, rather than blaming and trying to point fingers and trying to get loopholes, as Dr. Hemantha Herath very correctly said, at least, you know, I think if I am right, a certain small percentage, true, but have been vaccinated. And I am very confident that we will roll out the vaccination program, and the target is over 60%. That will happen within the next 6 months. I am very confident because I know the inside stories well.
Right. On that note, I think let's turn to the West. We have Dr. Michael Head joining us from the UK. Dr. Head, if you may shed some light, according to your research and your observations, on how the Eastern and Western vaccination drive has been operating, and what best approaches you see in which countries, with the specific importance and observations on Sri Lanka.
Thank you. So yes, the UK's had a very high burden of COVID-19 disease. We have a lot of deaths, well over 150,000 deaths. But right now we're in a much better position with the vaccine rollout. It's going very well here, and our cases and deaths have dropped significantly over the last few months, thanks in part to a lockdown, but also to the excellent vaccine rollout. I think I would agree with my colleagues there that the vaccine supply, that's the key bottleneck here. We do need to vaccinate the world. That's about 8 billion people, and most of the vaccines require 2 doses, so 16 billion doses. The demand greatly outstrips the supply. And I think part of the issue is that those of us here in the high-income countries in the global north have been hoarding the vaccines a bit too much. We should be doing a lot more in terms of distributing the vaccines to initiatives like COVAX, who can then forward it on to the countries that do need them. I would hope that we can look at doing that as the international leaders of the G7 and G20 meet, that we might get some commitments out of them. Let's hope they do, but certainly vaccines are the key weapon that will underpin progress towards the end of the pandemic.
I see that the studio is in agreement with what Dr. Head says, but to add to that, what more do we do to, what more should we do in order to work with the international community, the WHO, in order to ensure that we have a smooth supply of the vaccine?
I think we are already in operation, or we are already implementing our strategy. Basically, we are working very closely with the WHO and also the UNICEF and World Bank, and also there are so many other international agencies, donor agencies who are supporting us, like the ADB, World Bank, and from those donors, our financial capability to purchase this vaccine is in a way secured. And from there onward, our main challenge was to find out the sufficient stocks of vaccines to be rolled out in the country. So at this moment, due to the many, so many reasons beyond totally our control, the challenging part is to secure the stocks from different sources, and the Ministry of Health, the Foreign Ministry, and not only the government officials, politicians, but as well as not only the government politicians, but I know that even the opposition politicians are also supporting this process because this is something for the people of the country, and I hope, and we are fully confident that within the next couple of days we will be getting the next stocks of vaccines, and this will continue.
Okay. I'd like to come back to this conversation, but we'll have to take a short commercial break here at Hyde Park. Welcome back. I'd like to turn to Dr. Michael Head once again. Dr. Head, we're talking about the situation globally, the vaccine situation, the availability, and the constantly evolving pandemic, the virus itself. So do you think there will be a need to continue to upgrade and continue this research globally in improving the vaccines? Dr. Head, are you with us? I think we have a technical difficulty there, but let me turn to Dr. Attula Sumathipala. You had something to add to what Dr. Hemantha Herath was saying.
Not only to that, even to answer your question to Dr.
Head, yes.
As I told you, this is a new disease. The global knowledge which is generated through research is limited. There is a huge gap. So we don't know for certainty whether we have to stop with 2 doses or whether we might need the 3rd one. Because it's very difficult to right now predict the level of immunity, how long will it last, the boost and things like that. So this is part, as I said, the global knowledge gap in science when it comes to COVID. But adding to what Dr. Herath said, we have to remember 80% of our vaccines in the past, we relied on Serum Institute in the past. Now this was not WHO's unwillingness or the Sri Lankan government failure. It was simply an issue of production due to many different reasons, and the predicted doses couldn't be given to the WHO or the COVAX facility or for us to buy. So people sometimes accuse by saying this because again, it's Serum, in addition to Serum Institute, Korea produce it, England produce it. So it's a scarce resource. But the good thing is we have got other 2 vaccines, particularly the Chinese vaccine and the Russian vaccine, Sputnik, coming in, and it's a matter of time. So we have to be patient, and as we said, Dr. Head said very correctly, vaccine is one of the most important strategies in combating this pandemic, but it's not the only. We have to remember it's one of the main tools. Even if we vaccinate 60%, we still have to follow all the basics things, because even vaccinated people with 2 doses can be infected. What the vaccine actually prevent would be the complications and death.
Right.
But people can be infected and they can still be carriers. So this is not one size fit all just solution vaccine, but it's one of the strategies, but it has to be coupled with the public health principles to prevent the primary resource spread.
Dr. Head, do you hear us clearly? Dr. Michael Head? I think our studio will try to see if our audio transmission is until we connect with Dr. Head once again, Dr. Hemantha Herath, about the vaccination drive itself, but there is also a psychological aspect that we have to talk about, that we cannot ignore as we talk about this, because since last year we entered into a phase that was unknown to humanity in recent decades, or at least in the century that we know of and we talk of. But the psychological difficulties, the concerns that people have, what measures should we take, at least, although we cannot, while authorities are trying to combat the pandemic in the ground, what do we do at home? How do we work in order to ensure that we have a sound mind while we continue to engage in our work?
I think rather than starting that, because when we have the specialist in that area, I think Professor Sumatipala will be the best person to answer this question. Okay. Why should I start it?
Okay, thank you very much, Dr. Herath. Yes, it's my specialty, it's my expertise, true. Now, again, we have to understand this in context. Now, at the very beginning, first round, first wave, we had only 3,000 patients and 13 deaths. Okay. So, during that time, again, we didn't know much. People were very uncertain, they were locked down, they coped. The coping strategies are very different from people to people. So they expected the worst case scenario, witnessing what happened in the other parts of the world, but with 3,000 cases and 13 deaths, people settled down. Now remember, when it comes to psychological consequences, we have to remember, we are not talking about mental illness. It's very natural, everybody to feel very worried, uncertain, frightened. With that uncertainty, there's a lot total chaos in the head. People were panicking, buying things. But with the settlement, the pendulum actually swung to the other side, unfortunately. Then people were very complacent and they settled down. They were not worried, because some people are thinking, okay, so what? If you don't die, it's like another common cold. So people started relaxing. But now the most important thing right now is people have got into a situation of panic. Now remember, when it comes to psychology, fear is not necessarily a negative thing. Because people are frightened, with the secretion of adrenaline hormone, we either fight, fly, or get frightened. That's a coping strategy for animals, human beings. But when the quantity and quality of this fear exceeds, people become panicky, worried, and you would expect somebody who is frightened and worried will necessarily seek treatment. It's not like that. All my research in Sri Lanka shows fear is one of the fundamental determinants of people seeking help. But at the same time, some people hide, don't want to, they are frightened of death. But the contradiction here is, because they are frightened of death and the illness, they come into what we call the denial. They think it's not. So my advice, people need a lot of support. My plea to everybody now, with this pandemic, there was something called WHO called infodemic, disinformation and misinformation, which is totally negative, wrong, counterproductive. And my plea to people who use mass media, then Facebook and things, don't say contradictory things to confuse people. As a scientist, I think it's a crime to make people feel confused, uncertain by either deliberate disinformation. Let people settle down. Yes, we will be truthful, share the things, but that shouldn't be aimed at frightening people, but instead educating people. Creating fear as a health education tool is totally wrong, but at the same time, complete denial is also bad. We have to have, as you very correctly said, a sound mind and support other people and understand this is a national challenge which everybody has a role to play. It's not only the president or the prime minister or the media or the health minister or Dr. Herath or the DG, all of us. And that's my plea. Don't lose hope. When you are depressed, when you are worried, even your immune system can go down.
Right.
Let's get together as one nation and fight this back.
Dr. Head, I was trying to talk to you earlier about the changing nature of this virus. It seems to be mutating faster than we can understand. And these measures that we're taking globally, the research that is put into the vaccination, how do you observe this?
Thank you. Yes, I did lose sound for a little while then, so I didn't hear all the previous conversation. In terms of the new variants, I mean, they are called variants of concern for a reason. It's because they may have qualities that make them more transmissible. They may potentially cause a higher mortality rate, and they may have an impact upon the vaccinations. Now, so far, the impact of the variants upon the vaccination does not appear to have been too great, which is good news. It may have an impact upon not being so protective against a mild illness, but they do all seem to be, all the vaccines appear to be effective against all the variants we know about so far at keeping people out of hospital and lowering the mortality rate. So that is still good news, but clearly we do need to keep an eye on these things. The world's capacity to sequence the virus to check out these new variants is very limited. The ones we do know about, like the variants that were first observed in India and the UK, I think they probably are both in Sri Lanka, and may well be driving these new outbreaks, perhaps. But this is a good reason to vaccinate the world as fast as possible. The more COVID-19 you have, the more likely you are to see new variants of concern emerging. So if we want the world to get back to reset back to 2019, if you will, then again, we're going back to vaccines again. That's the key weapon here. So we do need to speed up their production and speed up their distribution around the world.
As we talk about production around the world, I think in Sri Lanka the concern has been about the efficacy of the vaccinations. If you may share with us some information, we have our own medical professionals too who continue to educate our people about the efficacy levels, about the need to be vaccinated. But then again, the concern about which vaccine works better. Is this good for me? Is it good to take one dose of a particular vaccine and then take the second of another in the case of a shortage of vaccine supply? But how will you share your knowledge and research with us in this aspect?
So I think the best vaccine is the one you're offered, essentially. We have many approved vaccines around the world. We have the Oxford AstraZeneca vaccine. We have the Pfizer and Moderna vaccines in some countries. There's Johnson & Johnson. There are a few vaccines out there. They are all highly effective. They're actually pretty similar in terms of their levels of effectiveness, particularly the two-dose vaccines, where you tend to get around 70% effectiveness after one dose, and then it's over 80%, around 90% perhaps, effectiveness after two doses. So they are wonderful products, they really are. In terms of mixing vaccines, there are trials ongoing actually at the minute to look at the evidence base there. There's no reason why it shouldn't still be highly effective to use one vaccine for one dose and a different vaccine for the second dose. But obviously we would feel reassured if we had the data to prove that, and that data will be coming in over the next few weeks from the trials that are ongoing in different countries around the world. So we shall see on that. But I think if people do turn up for their second dose and it's different to the first dose, they need not to be alarmed by that. They are still likely to develop very, very good protection against this virus, which is vital in order to keep outbreaks down.
Thank you. We'll take a short commercial break here at Hyde Park to return to speak more. Welcome back. I'd like to turn to Dr. Head once again to ask you something I began the show with about the Western and Eastern vaccination drive. If you may talk to us a little about these approaches and what countries have actually taken effective measures so that we can also learn from them, and probably our strategies could be shared with the rest of the world.
So here in the UK, one of the things we did do was lengthen the gap between dose 1 and dose 2 to about 12 weeks. And we did that in part because we had such a high burden of COVID-19 disease. We thought it best to at least partially protect as many people as possible, particularly vulnerable populations. in order to reduce the impact upon our hospitals and reduce the number of deaths. And actually that has proven to be a successful strategy. So lengthening the gap between dose 1 and dose 2, when you have a shortage of supply, is one strategy that could be taken forward by countries around the world. Other countries like Israel managed to get their vaccines out very quickly. The United States have also scaled up their vaccine response. So making vaccines as accessible as possible. So here in the UK, we don't have to go too far to our nearest vaccination centre. They are literally all around the country. So again, that makes it easy for us to go and get vaccinated, and we are therefore more willing to do so. I think those are all key aspects that can help underpin a strategy and could potentially be replicated in other countries.
Dr. Herath, talking about here in Sri Lanka, this week we surpassed the 3,000 daily load of cases reported here in Sri Lanka. With that, how are we going to manage the situation? Especially, I'd like to link to something that Professor Sumathipala also mentioned. Did we give a false sense of security during the festive season to the people? Did we give them that sense of security so that they can go shopping? And did we relax and maintain our restrictions in such a way that psychologically they felt that they could continue to do this amid a pandemic situation?
Basically, again, I would say that we never relaxed, or we never informed the public that now the things are okay, you can move freely. That was not the message that we passed. We continued to tell the risk, and also requested the public to behave in a manner which will be conducive to reduce or prevent any kind of outbreaks of this nature. However, what we did not do was that, as Professor Sumathipala very correctly pointed out, we did not want to create any fear among the people. We did not do that. And probably, I won't say that because of that, but the magnitude of our strength of our message would have gone to a level where, the expected behavior change would not have happened, but there can be certain faults from our side also, because the behavior communication is a very complex matter, and it's we are doing this kind of activities also, or what do you say, that risk communication, behavior communication, we have been doing it, but for this disease, it is for the first time that we are experimenting still, and therefore, I think during that time, before or pre-festival time, we passed this message, but probably, this is my personal opinion, there were, I won't say that failure, but it was not as effective as we expected. So as a result, probably not necessarily the visiting of relatives and other things, but we know that there was a huge overcrowding at shopping complexes and other places, and which was one of the very good reasons.
Which could have been avoided too within the country. Professor Sumathipala, about the period of restrictions that we're entering into, also now these are quite tight measures that we are taking going forward, but the question about whether it could have been done during the festive season, now there's no point in talking about it, because there were measures taken by Sri Lanka to reduce the daily load. Also since January we had less than 900. But about the current situation of managing these patients, about the care given to these patients, and also about the psychological support while they are being treated and in care, what measures are authorities taking?
But before I answer it to the question of management and psychological things, let me reassure you, I don't think we did something wrong during the festival season, because the number of patients went down to 150, and this is a democratic country where people are given freedom, right? So at the same time we had to give some responsibility, and even for children we give freedom for them to behave, we supervise, true, because the cases were going down, and the fact that people couldn't celebrate the cultural things, it was relax. But this is very complex thing. Again, context matters. Even the powerful countries like UK, USA, people who would behave well, you know, health literacy is much better. Things have gone wrong. People, reflection is very important. We have to reflect and learn from, I don't want to say even weaknesses, it's limitations and filling the gaps. So that's what we are doing. Even if the case load was 10, things would have gone wrong. And I'm very confident this way, we are in a very serious situation, true, but even after we control this wave, you can't rule out further waves may erupt, not only in Sri Lanka, as Dr. Head said, until the global population majority is vaccinated. Now coming back to your thing.
Question.
Management, psychological management is extremely important, because now we can talk about the statistics, we can talk about many different things. At the end of the day, the person who gets affected is frightened of death. That's a fact. When somebody is in a hospital, family is affected psychologically. So we can't completely ignore and cater only to the physical side. So therefore, I want to make a reassurance to people. Yes, case numbers are going up. True, it's a huge challenge. The public needs to take this in context and understand their role. Now, for example, we have 9 tertiary hospitals in this country, like IDH, Mullaria, but at the very beginning, it was only IDH. So it has expanded. We have secondary hospitals, 59, where there are 5,400 beds. Now, intermediate care centers are 44. At the start of this wave, actually these were very much less.
Right.
Now it's gone up, 11,800, total 22,000 beds. In the private sector, there are 3,376, 27 hotel hospitals, and Army has 500. So these are expanding, and the most needy people will go into hospital. That's the right thing to do, because people have a right to have the best care in hospitals. But having said that, there is a legitimate delay in evacuating people, because we have to realize even to get a PCR it takes 1 day, but sometimes more. So it's a complex situation, mobilizing people. So what people need to do, stay calm. If they get symptoms, inform the relevant authorities, and if really things are changing, there is a network of people they can contact the hospitals. And what I can assure you is, nobody will be neglected, but there will be shortcomings when you go to an intermediate care center. Of course, it's not your home. You are not sleeping in your bed.
Yes.
So this psychological thing, people need a lot of support, caring. People who are not affected can, you know, contribute in many different ways. Cut down your consumptions, donate, support, because as a nation we have to get together and emerge once again as one nation victoriously. It's a challenging thing.
Dr. Herath, we're talking about the requirement for more doses of vaccines. If you can give us some statistics on how much we need, what we need, and when we are expecting these also.
Our initial plan was relying on the 4.5 million doses that was expected to come from the WHO COVAX facility. We were planning to vaccinate around 60% of the population, depending, because at that time again we'll have to take into keep in our mind that the knowledge about the vaccination was again evolving, and as a result we did not know whether we could be able to give it to young people, children, pregnant mothers, lactating mothers, and what would be the real repercussions of the when it given to the people with other diseases, older people. So having taken everything in consideration, we thought that at least 50 to 60% of the population need to be, and we were planning to buy at least initially 18 million doses of vaccination, apart from the 4.5 million from the COVAX facility, and we were, to my knowledge, we secured funds for around 10 million doses. However, when we ordered, Again, if I can remember, that we ordered 1.5 million initially, and only 500,000 arrived, but before that there was another 500,000 donation from the Indian government, and then the COVAX facility gave 264,000 doses, and that was the AstraZeneca doses available, roughly 1.2 million doses. Okay. So that was the one that we started. Then we got 600,000 Sinopharm vaccine and around 15,000 Sputnik vaccine from Russia. And we have already now completed vaccinating almost all available vaccine stocks, and currently we are expecting very soon another stock of vaccine from China as well as from Russia. Dates in this moment I am not in a position to confirm and the total amount, but I am very much confident that these vaccine stocks will be available soon, and we will be able to continue our second dose vaccination as well as continue or expand the vaccination. Now we are planning to complete the Western province and then planning to go to other provinces as well. So that will be, we will be able to achieve our targets.
Right. Dr. Head, the final question to you tonight. We talk about the evolution of the virus, the developments globally. If you may finally share with us some research on the kind of medical research that's going into this evolving situation.
So research around the world is looking at sequencing of the virus to identify emerging variants that might be defined as variants of concern. There's a lot of research looking at the impact of the different variants upon vaccine effectiveness. That's going to be key. Thus far, it looks like we've been a bit lucky in that the variants haven't had a huge impact upon vaccine effectiveness. They may have made it still a little bit more likely that you'll get a mild infection if vaccinated, but your protection will still be sufficient to make sure that you don't end up in hospital or die of it. The vaccines are currently very effective indeed, about 80 to 90% effective after 2 doses. But clearly with variants of concern, what we don't want is a new variant that does impact upon the vaccine rollout. So the key thing in the meantime is for all countries to keep cases as low as they possibly can whilst that vaccine rollout is happening. And then hopefully we can contain the pandemic and get cases down very, very low across the world as soon as possible.
Can humanity catch up to this evolving nature of the virus, the mutating the nature of this virus? How do you observe this?
I mean, yes, humanity will catch up with it, and the world will conquer COVID-19 in the sense that the pandemic won't last forever. We will get over it. There will still be COVID-19 circulating around the world at low levels, so it will be for governments and other decision makers like the WHO to work out how to best handle low levels of COVID-19. But clearly, high levels of vaccination will be key for everyone, and that's important to maintain. It might be that in the future we might need booster vaccines if a new variant emerges that requires it, or if the immunity from the current vaccine starts to wane. We don't know how long the immunity will last from these. So COVID-19 will be an ever-present problem, but it won't be anywhere near on the scale that we're seeing at the minute. So the world will get through this eventually.
Thank you very much. We had with us Dr. Michael Head, Senior Research Fellow for Global Health Clinical Informatics Research Unit of the University of Southampton. Thank you very much for joining us tonight at Hyde Park. And we also had with us Professor Atula Sumatipala, Chairman of the National Institute of Fundamental Studies and a member of the National Operations Centre for the Prevention of COVID-19 Outbreak. Thank you very much for your time here. And Dr. Hemantha Herath, Deputy Director General for Education and Research of the Ministry of Health. Thank you very much. And tonight at Hyde Park, we were talking about the ongoing situation in Sri Lanka, measures taken to combat the virus and whether we are on course. Thank you for watching. Have a pleasant evening. Good night.